A definition of erectile dysfunction, ED. In this blog post, we will be discussing alternative treatments for ED, their effectiveness and scientific evidence, and their importance of consulting with a healthcare provider before starting any new treatment regimen. 1. Erectile dysfunction, ED, is a condition in which a man is unable to achieve or maintain an erection sufficient for sexual intercourse. 2. Erectile dysfunction is also known as impotence, and it affects a significant number of men, especially as they get older. 3. Erectile dysfunction is caused by a variety of factors, including physical, psychological, and lifestyle-related issues. 4. Erectile dysfunction can have a significant impact on a man's quality of life and can lead to feelings of low self-esteem, depression, and anxiety. 5. Erectile dysfunction is a common problem, but it is not a natural part of aging. 5. With proper diagnosis and treatment, ED can often be effectively managed. The prevalence of ED. 1. Erectile dysfunction is a very common condition, affecting an estimated 18 million men in the United States alone. 2. The prevalence of erectile dysfunction increases with age, with approximately 5% of men at the age of 40 experiencing ED, and this number increases to 15 to 25% of men by the age of 65. 3. However, ED can affect men of all ages, and it is not exclusively a condition of older men. 4. Studies have also shown that ED is more common in men with certain medical conditions such as diabetes, hypertension, and cardiovascular disease. 5. Also, lifestyle factors such as smoking, obesity, and lack of physical activity can also contribute to the development of ED. As we can see, erectile dysfunction is a condition that affects a significant number of men, and it is important to understand the various factors that contribute to its development. In this blog post, we will explore the different alternative treatments that are available for ED and the effectiveness of these treatments. See importance of finding effective treatments. Erectile dysfunction can have a significant impact on a man's quality of life, affecting not only his sexual health but also his relationships, self-esteem, and overall well-being. It is important for men to have access to effective treatments for ED to help them regain their sexual function and improve their overall quality of life. Effective treatments for erectile dysfunction can also help prevent other related health problems that can arise from this condition. For example, research has found that men with ED are at an increased risk of developing cardiovascular disease and other serious health conditions. Finding effective treatments for erectile dysfunction can not only improve men's sexual function but also help prevent these serious health problems. Furthermore, since ED is a common problem, effective treatments can help save men from the emotional distress and embarrassment associated with the condition, and their partners can benefit from the treatment too. In this blog post, we will be discussing the alternative treatments for erectile dysfunction and their effectiveness, with the idea to help men have better access to effective treatment options. 3. Alternative treatments for ED. A. Acupuncture. Acupuncture is a traditional Chinese medicine technique that involves the insertion of fine needles into specific points on the body to stimulate energy flow. Some studies have suggested that acupuncture may be effective in the treatment of erectile dysfunction. The studies suggest that acupuncture may help improve blood flow to the penis, which can lead to better erections. It may also help to relieve stress and anxiety, which can contribute to ED. Acupuncture is a non-invasive treatment option and it carries very little risk. However, it's important to seek treatment from a qualified acupuncturist who has experience treating ED. It's also important to keep in mind that acupuncture may not be effective for everyone, and more research is needed to determine its effectiveness. In this blog post, we will be discussing the available alternative treatment options for ED, including acupuncture, and the effectiveness of these treatments based on scientific evidence. It's important to consider all treatment options, including alternative therapies, and consult with a healthcare professional before starting any new treatment regimen. B. Herbs and supplements, for example ginseng, horny goat weed, etc. Herbs and supplements have been used for centuries to treat various health conditions, and some are believed to be effective in the treatment of erectile dysfunction. For example, ginseng is an herb that has been used in traditional Chinese medicine to improve sexual function. Another herb that is commonly used to treat erectile dysfunction is horny goat weed. It's believed that these herbs may help improve blood flow to the penis, leading to better erections. Similarly, some supplements such as L-arginine and DHEA are known to improve blood flow and improve the symptoms of ED. However, it's important to note that the scientific evidence supporting the use of herbs and supplements for erectile dysfunction is limited and more research is needed to determine their effectiveness. It's important to be careful when taking herbs and supplements, as they may interact with other medications or have other potential side effects. It's always a good idea to speak with a healthcare provider before taking any new supplement or herb. In this blog post, we will be discussing the available alternative treatment options for erectile dysfunction, including herbs and supplements, and the effectiveness of these treatments based on scientific evidence. It's important to consider all treatment options, including alternative therapies, and consult with a healthcare professional before starting any new treatment regimen. See yoga and other forms of exercise. Yoga and other forms of exercise are known to have many benefits for overall health and well-being. There is some evidence that suggests that yoga and exercise may also be beneficial for men with erectile dysfunction. Research suggests that regular exercise can help improve blood flow to the penis and improve the ability to achieve and maintain an erection. Yoga, in particular, has been shown to be effective in reducing stress, anxiety and depression, which are some of the main psychological causes of erectile dysfunction. Exercise and yoga can also help men to maintain a healthy weight, reduce blood pressure, and improve cardiovascular health, which are all important factors in the treatment of erectile dysfunction. It's important to note that while there is some evidence that exercise and yoga may be beneficial for ED, more research is needed to fully understand their effectiveness. It's important to consult with a healthcare provider before starting any new exercise routine. Additionally, one should not use the information on this site for diagnosing or treating a health problem or disease, or prescribing any medication or other treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. In this blog post, we will be discussing the available alternative treatment options for erectile dysfunction, including yoga and other forms of exercise, and the effectiveness of these treatments based on scientific evidence. It's important to consider all treatment options, including alternative therapies, and consult with a healthcare professional before starting any new treatment regimen. Psychosexual therapy. Psychosexual therapy is a form of therapy that can help men with erectile dysfunction to address any psychological or emotional issues that may be contributing to their condition. This type of therapy can help men to identify and work through any underlying psychological or emotional issues that may be contributing to their erectile dysfunction. This can include things like stress, anxiety, depression, relationship problems, and other issues. During psychosexual therapy, a therapist will work with a patient to develop coping strategies for dealing with psychological and emotional issues that may be contributing to erectile dysfunction. The therapy sessions may involve individual or couples therapy. The therapist may also provide advice and guidance on ways to improve communication and intimacy in the relationship. While psychosexual therapy can be effective for some men, it's important to note that more research is needed to fully understand its effectiveness. Additionally, men with severe psychiatric disorders, severe relationship problems, or other severe emotional issues may need to seek additional treatment for those specific issues before or in conjunction with psychosexual therapy. It's important to consult with a healthcare professional before starting psychosexual therapy, as this type of treatment may not be appropriate for everyone. The therapist can help you determine if psychosexual therapy is right for you, and how you can best benefit from this type of treatment. Platelet-rich plasma, PRP, therapy. Platelet-rich plasma, PRP, therapy is a relatively new treatment option for men with erectile dysfunction. This therapy involves using a patient's own blood, which is processed to extract a concentrated solution of platelets and growth factors, which are then injected into the penis. The theory behind PRP therapy is that the concentrated solution of platelets and growth factors will stimulate the growth of new blood vessels in the penis, which can improve blood flow and lead to better erections. Some studies have suggested that PRP therapy may be effective in the treatment of erectile dysfunction, but more research is needed to fully understand its effectiveness. PRP therapy is a non-surgical procedure, and it carries very little risk. However, it's important to seek treatment from a qualified healthcare professional who has experience with PRP therapy. It's also important to keep in mind that PRP therapy may not be effective for everyone, and more research is needed to determine its effectiveness. In this blog post, we will be discussing the available alternative treatment options for erectile dysfunction, including PRP therapy, and the effectiveness of these treatments based on scientific evidence. It's important to consider all treatment options, including alternative therapies, and consult with a healthcare professional before starting any new treatment regimen. Additionally, one should not use the information on this site for diagnosing or treating a health problem or disease, or prescribing any medication or other treatment.